gonna shoot it to you straight when it comes to sciatic pain. A lot of experts will tell you you need to stretch out to relieve your sciatic pain. Some of them will say don't stretch because that's gonna make it worse. Well, the reality is it just really depends on where that sciatic nerve pain is actually coming from. So in this video today, I'm gonna be talking to you about what is sciatic pain, why it's coming down through your body, how to relieve it through exercises and some stretches. I'm Charlotte Varvel, massage and craniosacral therapist, and welcome to your session of body therapy where we focus on physical, mental, and emotional wellness. A big part of this video today is helping you to create an environment of healing inside of your body so that your nerve can actually heal. The sciatic nerve has 5 branches. It will come out of the low back at L4, L5, S1, 2, and 3. These come out, form together in a large thick bundle of nerves, and then travel down through the glutes and down the legs, and then branch out again at the lower leg going into the feet. Sciatic pain can be caused from a few different things. It can be caused from a bulging disc, from degenerative disc disease, or from something called Piriformis syndrome. Now, 90% of sciatic pain is going to be coming from a bulging disc, but there is a percentage of people that will have Piriformis syndrome. I'm going to be talking about exercises and stretches to support both the low back and the Piriformis syndrome. When you have a bulging disc, then you might be experiencing sciatic pain because you have squishy discs that are located between each of your vertebrae on your spine. These discs that affect the sciatic nerve are between L4 and L5, L5 and S1. These discs are kind of like a jelly-filled donut, and sometimes they get squished and that jelly can just squish right out, creating some impingement on that nerve and creating pain. When it comes to piriformis syndrome, we have a muscle called the piriformis that goes from the sacrum over to the greater trochanter located on the hip. This muscle going horizontally, the sciatic nerve will go straight through it, underneath it, or over it, depending on the person. When this muscle is tight, it can impinge on that sciatic nerve, creating pain. So we're going to be talking about some very important exercises to stabilize the core through the lower abs and the glutes. The first muscle group we're going to address is the glutes. You want to do this muscle activation exercise either lying down or sitting. I'm going to demonstrate this for you lying down. You're going to want to squeeze your glutes without activating the thighs. Your thighs are going to want to take over if you have weak glutes. We do this by gradually increasing the tightness of the glutes. You're going to squeeze those glute cheeks together slowly, trying your best to allow your thighs to be relaxed. To do this activation, we're going to hold this for 10 seconds, release, and then hold it for 10 more seconds, release, doing this 10 times total. This gradually over time is going to create a strengthening of this muscle group, which is going to support your sciatic nerve pain. The next muscle group we're going to address is the lower abs. When these lower abs are nice and strengthened and activated, it creates a stabilization. It's like it's saying to the low back, you're supported, I got you. You're also going to want to be doing this exercise lying down. And how you do this is you take your hips and you rotate them up towards the ceiling. So you're creating a flat back. We're rotating the hips upward, squeezing those lower abs, activating this muscle group. When you have weak lower abs, those upper abs are going to tend to want to take over. Just like with the glutes, we slowly move into this exercise, focusing on mind to muscle. Even put your hand right on those lower abs as you gradually move your pelvis up and squeeze that, just to make a connection to, I am only activating my lower abs at this time. There's always going to be some level of entire ab. You can't separate it completely, but we're going to do our best to strengthen this area of your body. Just like with the glutes, we squeeze this for 10 seconds, hold, and release. Squeeze again, hold for 10 seconds, Release doing this 10 times. You can do this with the other exercise as many times as you need to throughout the day. And gradually over time, we're creating this stabilization, taking pressure off that low back, supporting that sciatic nerve to really heal. Now I'm going to be going into the stretching portion. I'm going to share with you 3 stretches that you can do plus some nerve flossing. In this situation, more pain does not equal more gain. If you are experiencing an increase of your sciatic pain by doing any of these stretches, please back off, only go to your comfort level, because this is going to help reduce any unnecessary aggravation of the nerve. The first stretch we're gonna do is sitting knee to chest stretch. So you're gonna take the leg that is experiencing the sciatic pain and take that crossing over the other leg. The goal here is to take your knee up to the chest area. We're gonna hold this for 30 seconds. Go ahead and do that right now. I'm gonna invite you to keep a very straight back through this stretch. We don't want to be creating any sort of twisting of the low back. We're only stretching that piriformis muscle. That is our goal here. I'm going to have you do this on the other side as well. Go ahead and take your leg up over and take that knee up into your chest, keeping your back as straight as possible. The reason why I'm having you do this side is oftentimes when we have pain on one side, the other side of our body tends to compensate, getting really tight and overused. So this is helping this side to stretch out as well. This next stretch is a foot to chest stretch. We're going to do this by taking your leg, bringing that foot up as close to the chest as possible. Go ahead and have one hand on the knee, stabilizing and bringing that up into the chest. We're going to start this stretch, hold it for 30 seconds right now. Again, keep your back as straight as possible. We want to create the least amount of movement and bend, just stabilizing that low back to support where that sciatic nerve comes out. Deep breaths are always great. Okay, go ahead and do that on the other side. Bring that foot right up into your chest. Keeping the back as straight as possible. If you're experiencing extra pain here, just back off. Go only as deep as it's comfortable for you. This next stretch we're going to do lying down. So go ahead and lie down on a mat or the floor, your bed, and bring one knee up to the opposite shoulder. Remember to keep your back as stabilized as possible. We're going to hold this for 30 seconds starting right now. Remember to breathe through this stretch. Go a little deeper if you can, if it's comfortable for you. Creating a really great stretch in that piriformis muscle. Okay, moving right into the other side. Bring that knee up to the opposite shoulder. Keeping back stabilized and straight, and just bring it in as closely to that shoulder as you can. We're giving the opposite side of your body some love, making sure that that is stretched out and taken care of. The next exercise that we're going to do is a gradual nerve flossing. This is going to create some release of the pressure on that nerve. Do this by lying on your back and then bringing the leg that is experiencing the sciatic pain up into the shoulder. So your knee is going to be bent and your hands are going to be behind your leg on your hamstrings, and just bring that in. Then you're gonna release and bring it in. We're gonna do this several times. If this feels good, then we're going to do some ankle pumps, where you're gonna flex and extend your ankle several times. If that feels good, then we're gonna move into the full extension. Go ahead and bring your leg up to the ceiling and then back down. You're only gonna wanna be going as deeply into this as is comfortable for you, but we're gonna do this about 15 times. This is releasing pressure on that nerve and creating freedom of movement throughout the sciatic. Let's go ahead and do that on the other side for balance. Bring the other leg up, bring the knee into the armpit, release that, and do that a few times. If that feels good, then go ahead and do some ankle pumps, flexing and extending, creating some freedom of movement there. And if that feels excellent to you, go ahead and bring that leg up to the ceiling, come back down and do this about 15 times. I hope that you are feeling amazing. I hope your sciatic nerve is relieved for you today. I would love for you to subscribe to the channel and share this video with anyone else that might be experiencing some sciatic pain as well. Like the video and comment. Let me know how this routine went for you. I would love, love, love to hear it. For further support in being able to work through the emotions that might be stored in this area of your body, then I'm going to invite you to check out Emotions in Your Muscles Explained, and we'll see you on the next video.